Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm absolutely delighted to have as my guest Dr. Caldwell Esselstyn. Dr. Esselstyn is a prominent physician and surgeon. He has served as the director of the Heart Disease Reversal Program at the Cleveland Clinic, where he was involved with iconic research that is so well known now to both the lay and professional scientific community on applying low-fat, whole food, plant-based food for the prevention and reversal of heart disease, which was published in a best-selling book, Prevent and Reverse Heart Disease, the revolutionary scientifically proven natural or nature cure or natural cure method, and also the Prevent and Reverse Disease cookbook. Dr. Esselstyn has been featured prominently in videos Forks Over Knives and The Game Changers. He's been on the advisory board of the Nutrition in Action magazine, which was published by the Center for Science and the Public Interest. He's one of the first recipients of the Benjamin Spock Award for Compassion in Medicine. And he's got other really so many interesting accolades as being an Olympic gold medal winner as a rower back in the 50s, and also a decorated war veteran receiving the Bronze Star as an Army surgeon in the Vietnam War in the late 60s. Welcome, Dr. Esselstyn. It's such a pleasure to have you here. Thank you, sir. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Frank, thank you.
Yeah, as I went through your history, it's almost, you've lived long enough. It's almost like a storybook to read some of the pieces that you have been participated in. And I wanted to ask you, because I know your father himself was a prominent physician and served as a consultant from your history in terms of Medicare with President JFK. And he also had Lou Gehrig as a patient, which, it just kind of blew my mind. With all of that, had you had contact with those luminaries as a younger person because of your dad?
Yes, and because I think I'm one of the few people who can say that they shook the hand of Lou Gehrig. I was 7 years old, and Dad had him around one day, and he was just a great big, healthy-looking specimen at that point.
That was before his ALS diagnosis. Is that it?
That was during.
Oh, during that time. Okay. Yeah, and just as another little piece, in terms of your own training, I know that your wife's grandfather was the George Washington Cryle, was really one of the founders of the Cleveland Clinic, and her dad, George Burney Cryle, was also a very prominent surgeon for many years. And I know that both of those men had really done some interesting work on conservative approaches to dealing with breast cancer. They were really ahead of the field. And I know that you served your residency and internship at the Cleveland Clinic. Did her father, did they factor into your own education in terms of any prominent role in your education as a physician and surgeon?
Absolutely. Ann's father, who was really the pioneer for more conservative breast operations, was an integral part of the teaching staff and senior surgeons while I was training. Yeah.
Yeah. So that was a big part of what you learned there. Many of the audience, many of the people know, of course, the work that you did in relationship to, heart disease reversal. Where in your own journey did the interest in plant-based living, and how did you start to apply that in terms of your own life and family? At what stage of your life did that start to become a piece for you?
It was probably in the late 1970s at the time that I was chairman of the breast cancer task force, that I became increasingly disappointed and disillusioned with the fact that no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. And so that led me to a bit of global research, and it was quite striking that there were multiple other cultures where breast cancer rates were 30 and 40 times less frequent than the United States. And when you look at rural Japan, in the 1950s, breast cancer was very infrequently identified. Yet as soon as the Japanese women would migrate to the United States, by the second and third generation, they now had the same rate of breast cancer as their Caucasian counterpart. Even more compelling was cancer of the prostate in the entire nation of Japan. In 1958, how many autopsy-proven deaths were there from cancer of the prostate? 18 in the entire nation. By 1978, they were up to 137, which still pales in comparison to the 28,000 who will die this year in this country from prostate cancer. But it was along in this journey, I began to notice that there were multiple cultures where cardiovascular disease was virtually non-existent. And it just dawned on me there would be a lot more bang for the buck if we could somehow convince people to eat in a way to save their heart, because in doing so, they would markedly diminish the likelihood of the common Western cancers of breast, prostate, colon, and pancreatic. But you just can't make that announcement. You've got to do research. And that's when I got started with our first group of patients who were ill with heart disease, to try to convince them to eat plant-based.
Yeah, so I know many people are familiar with the data that you have presented in the past. So let's talk about how you envision that process, how you set that up, and then take us through some of the results of that data, so people could really be kind of brought up to snuff on really the incredible power and impact that the plant-based approach had on this outcome.
Well, on this cohort, since I still had all my surgical obligations, the study by definition was quite small. It was 24 patients. And it was interesting. My major concern was that I was going to be asking these patients to eat a diet that was significantly different from anything that they had experienced before. And the whole idea was to eliminate the foods that injure the lining artery of the artery, the endothelium. And now, how do you get these patients to make this behavior change? I decided to use for that the same mantra that I had been using for my cancer patients, that I had learned years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their doctor or by their family. And so for the first 5 years, I saw these patients every 2 weeks in the office. We drew their cholesterol, checked their blood pressure. I went over every morsel they ate. At the end of 5 years, I was now able to turn it to once a month. Now, most cardiologists will see their patients twice a year. So I was seeing this group twice a month, again, with the same activity. By the time we got to 10 years, they were pretty well on autopilot. So I was able to extend it out to see them quarterly. But the results were kind of exciting, because we found that of the original 24 patients, I should say that there were 6 guys, nice guys, but they just didn't. I had no money for this study. They just didn't quite get it. So I released them full-time to their expert cardiologists, with the understanding that we would peek in again to see how they were doing. They became sort of my semi-control group. And the other 18 patients that stayed with us for the full 12 years. By 12 years, it was now the longest study of its type. And it was time to see if remember, they all had severe triple vessel disease when we started. They had no cardiac events during that follow-up period of 12 years. And so that was really something that inspired us. We were pretty well, obviously, we were severely criticized. Dr. Esselstyn, this is a small study. It's not been randomized. What makes you think you could repeat it with a larger group? And we did. this time we did it with some 200 patients.
Yeah, what were those years, Doc? What are we talking about in time?
This was I reported. Well, the first report was in the Journal of Family Practice in 1996.
Right.
Second report of the 198 patients was in 2014, again in the Journal of Family Practice.
I'm here with Dr. Caldwell Esselstyn. We're going to just take a short break and hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here. Are you ready for an extraordinary adventure that combines relaxation, exploration, and vibrant health? Then set your sails for the NHA plant-exclusive cruises. Imagine cruising through exotic destinations, savoring delectable plant-based cuisine, and engaging in rejuvenating activities, all while surrounded by like-minded individuals passionate about health and wellness. These cruises offer more than just a vacation. They offer an opportunity to immerse yourself in the NHA's principles of healthy living. And they rank incredibly high on the ratings of eco-friendly cruise lines. We all know how important our oceans are, and our cruise partner, Windstar, is fully committed to this. Join us aboard our upcoming plant-exclusive cruises and experience the synergy of health and leisure. Delight in gourmet SOS-free meals prepared by talented chefs. Attend informative workshops and enjoy the serenity of the sea, all tailored to nourish your body, mind, and spirit. For more details and to reserve your spot on our next adventure, visit healthscience.org and click the link under travel. Don't miss this chance to indulge in a wellness retreat like no other. Elevate your well-being and make memories that will last a lifetime. And remember, your feedback matters. Please take a moment to leave a rating and a review wherever you're listening to the NHA Health Science Podcast. I'm Dr. Frank Sabatino, your host. Now, back to the show. Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and I'm here with Dr. Caldwell Esselstyn going over the data that he was involved with in terms of the heart disease prevention studies that he was involved with. Yeah, when we talk about those larger studies, I was really quite mystified because when I went into looking at some of the people that were actually some prominent people that were even cardiologists within the Cleveland Clinic, they were still somehow challenging the idea that this was not rigorous enough, that they were not extensive enough. How did you address with that, almost that in-house conflict, it seemed, where people were kind of, I didn't really understand it because it looked to me like the sample size was significant. It looked to me like the database was significant, and yet they kept talking about the fact that this was not enough data. It was not rigorously controlled. We needed more. And
with all due respect, you have to know that I admire the clinic for keeping me on board. And at the same time, we have to recognize that they recognize that I'm an enormous threat to medicine's biggest cash cow. Where do you think 90% of hospitals have their major income? From what specialty?
Probably from cardiovascular treatment.
Absolutely.
Yes.
And the frequent phone calls that I get from PCD patients, Dr. Esselstyn, I have been told I have to have a stent or a bypass. I don't want to have it.
Right.
What can you do to help me? And so forth. I said, well, the decision will be yours, but we will present you with another option. And really what's quite striking, when you explain in detail to patients, which if we've got time, I'd like to do that with you while we've got a little moment this afternoon, explain to the patients exactly how it is they cause their disease and exactly how we are going to empower them as the locus of control to halt and reverse the disease. They don't have to have these interventions. Very, very rarely, very infrequently do they have to have. Because when you think about it, what present-day cardiology has to offer are drugs, stents, and bypasses not one of which have a single solitary thing whatsoever to do with the causation of the illness. So, why don't we talk about that for a moment? What is causing this illness? All experts would agree that where this disease has its inception, its onset, its beginning, is when we progressively injure the delicate innermost lining of the artery, the endothelium. And what makes the endothelium so magical is its molecule of gas, nitric oxide, that it produces, that is responsible for the salvation, preservation, and protection of all of our blood vessels because of its remarkable functions. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thick and stiff or inflamed and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaques. So literally, everybody on the planet Earth who has heart disease has their disease because by now, in the previous decades, they have so sufficiently trashed, injured, compromised their endothelial cells into an absolute train wreck so that there's no longer enough nitric oxide to protect us from making blockages and plaque.
Yeah, let me put something out to you, because one of the tenets of the NHA in their teaching is not only to support a plant-exclusive way of eating, but also what they call an SOS-free approach, meaning no added salt, oil, and sugar. There are data related to excessive sodium use that suggests that the endothelial glycocalyx, that protective barrier of the endothelium, can be actually harmed by excessive sodium that will interfere with the translation of L-arginine into nitric oxide. Do you feel that that's much ado about nothing, or do you feel that there's value in understanding that relationship of excessive sodium and salt to that additional damage to that lining? What do you think about that?
Yeah, it's in our book. We ask patients to eliminate salt.
So you're strongly feeling connected to that data, that really is a very valuable thing.
Yeah, but the one I want to also emphasize is what are the foods that every time they pass our lips, we injure the endothelial cells? They are: one, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a chip, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells, as does anything that's animal protein: meat, fish, chicken, fowl, turkey, and eggs. Also, anything that is dairy: milk, cream, butter, cheese, ice cream, and yogurt. Also, sugary foods, sugary drinks, diet colas. Also, we want to eliminate sugary foods: cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. And I'm a little bit of a stickler on nuts, especially peanuts, peanut butter, nut butters, cashew sauce, avocado, and lastly, coffee with caffeine. Decaf, yes, but coffee with caffeine injures endothelial cells. So, what are you going to eat? You're going to eat all these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. Now, here's the middle of the kicker. I made a change in our program about a decade ago that was out of respect for the knowledge that the endothelial production of nitric oxide is age dependent. You never heard of a boy or a girl at age 8 having a heart attack, right? No. They have nitric oxide coming out of their ears. But by the time they're beautifully healthy at age 50, they now have 50% of the nitric oxide they had when they were 25. And by the time they're 80, they've lost 70%. So the changes that I made a decade ago were: one, a greater stimulation of the endothelial production of nitric oxide. And number two, we embraced the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. So, with your permission, here we go. I need you to chew 6 times a day green leafy vegetable, approximately the size of 1/3 of a cup, after it's been steamed or boiled 5.5 to 6 minutes so it's nice and tender. And then you must anoint it with several drops of a delightful balsamic or rice vinegar. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme contained within the endothelial cell responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now the second benefit when you're chewing the green leafy vegetable, the second benefit, you restore the capacity of your bone marrow to once again make the endothelial progenitor cell, which will replace our senescent, injured, worn out endothelial cells. Now, the third benefit, when you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate you've been chewing to nitrite. When you swallow the nitrite, it is your own gastric acid, which is now further going to reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. What you're doing for minimal expense and no side effects all day long, dawn to dusk, morning to night. You are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there is a caveat to this, and that is toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids because antacids will reduce your gastric acidity, and you will be unable to reduce the nitrite to more nitric oxide. And the top 6 vegetables would be kale, Swiss chard, spinach, arugula, beet greens, and beets.
So that's the mainstay. That's the mainstay that has to happen daily.
That's it. What we're talking about here, the reason that my program succeeds where others may fail is nobody else is as mean as I am. I mean, you don't cut corners. If you do, it's not going to succeed.
There's a fine line between direct and mean, so I like the directness of it all. So that's important. Doc, can you measure, and has that been measured, an increase in the age-related decline in nitric oxide? Can it actually be evaluated in some fashion?
Yeah, well, you certainly can. I think you can do this by well, no, it's not easy to do in a doctor's office, but you can do it with in the research mode. The brachial artery tourniquet test, you take an ultrasound probe, place it over the brachial artery, and you get a readout of the diameter of the brachial artery. Then you use a blood pressure cuff that you encircle the upper arm and inflate it to a systolic blood pressure so that for the next 5 minutes, you have 0 blood flow to your forearm and hand. Then, after 5 minutes, you take off the blood pressure cuff, take off the tourniquet, immediately remeasure the brachial artery, and in the normal individual, it'll be 30% greater.
So that's a way that you can do that. Fantastic. Really fantastic. I'm here with Dr. Caldwell Esselstyn. And Dr. Esselstyn, for people to want to learn more about your work and what you're doing, what's a location, a website that they can go to?
I think dresselstyn.com.
And we see that in our show notes, and that's great. Yes, that's fantastic. When in terms of the studies you've done, you've had such a huge impact on highlighting the low-fat, plant-exclusive approach, as you've just defined and described. Other studies that have been done, of course, as you know, Ornish and others, have highlighted other pillars of lifestyle medicine like stress management, activity. Where do you feel, or do you feel any different about where those fit in now, this many years later, in looking at the kind of work that you've done?
Well, I think Dean and I have talked about this before, and in other words, there's several ways up the mountain. If people want to go heavily into stress management, I think that's wonderful. They can do that. On the other hand, there are other people that are unwilling to take that time off, and yet they can still if they're adhered to and follow the program that we've outlined, they can have absolutely brilliant results. I think it's sort of exciting, but the principle that we really want to adhere to if you're going to have success, you've got to have them understand they've got to stop eating the foods that are going to injure the endothelium.
Yeah, it's all about the food. We get that.
Yeah.
That's the highlight of this discussion. I get that. In terms of where you are now in the things that you're involved in and doing, talk about any of that. Are you doing any special programs? Are you involved in any special additional things that you're doing now privately with patients and guests? Talk about any of that may be going on.
Well, the thing that I think keeps me kind of exciting because when I see these patients, often no matter where they've turned, they're still having angina, they're still having chest pain, they're still having stents. And it's really kind of an exciting eureka moment for me when I feel the challenge to somehow have that individual grasp and get their arms around the understanding of the causation of their illness, how it developed, why it was produced. And I have to do that in a format that is not highly scientific, that they are going to be able to get their arms around. Because that's the really only way you can, to me, that's the only way you get success. There are two things that are so important. If you're going to have a patient learn, you must show the patient respect. The only way that I know to show a patient respect is to give them my time. So at the present time, what we have is I run this seminar in the Cleveland Clinic Wellness Institute and the Center for Disease Reversal. And what these patients are going to have is a 5-hour seminar. When you talk to most physicians, they rarely ever talk to a patient about diet. And if they do, they seem to have very little information about diet. But the 5 hours is going to make it so that these patients fully understand the causation of their disease and fully understand how we are empowering them as the locus of control to halt and reverse their disease. Now, since I'm a little bit old-fashioned, to make sure that patients really get it right, I insist that my secretary give me their phone number 2 weeks before the seminar, and I call them and have an opportunity to get my arms around their story. At the same time, ask questions of me so that coming to the seminar, we have a strong foundation from which we can move forward, which probably accounts for the last time we looked this up with that paper in 2014. Our adherence rate was 89.3, almost 90%.
Wow. So when they do this 5-hour seminar, does that involve having a lunch, having food, being exposed to any food prep, anything of that nature?
We don't, since it's all virtual.
Oh, I see. It's all virtual. Okay.
Pretty tough to do that, but you can't. That all became virtual, and when in 2020, when we got hit by COVID.
Yeah, absolutely. I understand that.
We handle more patients at a time this way. We usually do no more than maybe 25, sometimes 30 patients, and they're on the call, whether they're from Canada, overseas, or throughout the United States. Yeah, and to me, it's so gratifying and exciting to see them how rapidly they can turn the corner. And once they start to realize they're getting better, they're feeling better, their chest pain is going away, they are elated to think that they are in control of this disease that was trying to take them out.
So, and how often do you do that program, Doc?
Usually about close to 6 or 8 weeks.
Okay. And is there any follow-up with those people in any fashion?
Right now, we do it pretty well with it, but the follow-up has to be, we can't initiate it because of the numbers are just, for me to try to call close to 1,900 patients.
No, it's daunting. I get that. It's a daunting task. Absolutely. Yeah.
That isn't going to happen.
Yeah, I get that.
But what they understand is that we're never going to abandon them. And that if they have problems that are directly related to what they've seen us for, in other words, it's not grandmother's gallbladder or something like that, but it has to do with their heart disease and so forth, and they call my secretary and she calls me and I return their call.
Fantastic. Well, slipping into another note, I know that you've had a nice relationship with the National Health Association, and this coming summer, you will be one of the featured speakers on their event, which is, I know everyone is so excited and looking forward to. What does the NHA kind of mean to you? What makes you gravitate toward wanting to participate with them?
Well, I like to participate with many organizations that have their head in the right place, where they're really committed to helping their fellow man by education and increasing awareness of how they can really, as I mentioned before, they can be the focus of control, to be so far ahead of this disease, which is the leading killer in Western civilization.
Let me ask you, let's slip into something else, because I don't know if you remember the old comedian George Burns. Remember him, the guy with the cigar? When he was approaching 100, a reporter asked him, "What do doctors think about your longevity?" And without skipping a beat, he said, "All my doctors are dead." So you have lived a full life. I know that you've moved into your 90s now. So I want to ask you, how does Dr. Esselstyn take care of himself? How do you account, and what would you account for your own longevity? I know you had a very athletic early life. You were a gold medal Olympic winner. So athletics and athletic activity has probably been a part of your life, most of your life. So what would you account? What accounts for what you feel about your own longevity?
Well, I like to walk, and I like to bike. And I think the real reason we're holding on here is because of my wife, who absolutely is a genius when putting together plant-based meals in a way that not only are so delicious, but most importantly, they are nutritious, and really I think they sort of dot all the I's and cross all the T's, because that's an absolute key, I think, to keeping the old carcass going.
So she's feeding the longevity. That's where it's at. I get that.
And also, I think you've got to get to sleep and have friends, and have some sort of a circle of friends. Our closest circle of friends is usually our family, who right next door.
Well, I know your son and your daughter and your wife, and it's a family affair. You guys have really integrated this incredible way of thinking and being. And of course, it comes back to provide rewards. And those rewards are high level health and the kinds of things that, you're experiencing. So it's so nice to see that. It's so nice to see you walking that talk and experiencing the benefits and reaping the rewards of this way of living and eating.
Thank you, Frank.
Yeah. So as we wind this down, do you have any final or additional words you would like to really share with the audience out here?
Yeah, I think that I really see in the future, I see a seismic revolution in health. And the seismic revolution is never going to come about through another drug, another pill, another stent, another bypass operation. No, but this seismic revolution will come about when we in the profession have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them to eliminate chronic illness.
And that's within their reach, and they have the autonomy to do that, which is a remarkable opportunity for all of us. Mm-hmm. I can't thank my special guest today enough, Dr. Caldwell Esselstyn. I urge you all to follow his work, to really look into, what he's doing. The show notes show the location where you can follow him and find more about what he's doing. And I want to really thank him for being part of this incredible show today, sharing his insight, his experience, and his past work. And I want to really thank everybody that's out there that joined us today, because without you, we can't do what we do. And I want to really thank you for being part of this very active and healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to being with you on the next episode of the Health Science Podcast. Thank you so much, Doc. We so appreciate it.
Here's his dinner.
And I love that visual. That's a perfect visual to finish with. and I'm coming over. Put another plate up. You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.